Welcome to the Long-Term Care Chronicles podcast. In this episode, we're going to be speaking with John Fraser, who is the Member of Provincial Parliament for Ottawa South, who is the critic for health and long-term care, as well as for intergovernmental affairs, agricultural food and rural affairs, and interim leader of the Ontario Liberal Party. We're going to be discussing long-term care in Ontario. Let's have a listen. Thank you so much for coming on to the Long-Term Care Chronicles, John. And if you can just introduce yourself to the listeners.
Yeah, I'm John Fraser. I'm the MPP for Ottawa South. And I'm also the Liberal critic for health and long-term care and seniors and intergovernmental affairs.
Perfect. Thank you so
much. Also
much.
the House leader as well, too. So.
Oh, wow. Okay, great.
Well, there's a few of us, so there's a lot of jobs to go around.
Yes, I know. You're only a few members, but still very important to be part of the government as well. So the first question that I have here, since you are the critic for health and long-term care, the Ontario government, they announced large spending in building more beds and infrastructure to house new residents as long-term care homes have long wait times. And the latest designed standards, according to the Ontario Long-Term Care Association, has half of the existing long-term care homes don't meet the physical standards in terms of the amount of space per resident, and the amenities provided are outdated. What would you say that how quickly we need to be able to change that?
Well, I think we have to change that, and we're a government. We try to get a balance. I think over 15 years it was 30,000 beds, almost split equally between new beds and redeveloped beds. Because if a bed, for instance, in my riding here of Ottawa South, St. Patrick's Home, wanted to do a redevelopment, add new beds, and but they were 40 years old. So they were still 4-bed wardrooms, like doorways, and all the standards were way out of whack. And it made it hard for things like infection control, which you see right now in the pandemic, how exposed those deficiencies make us to things like not having proper infection control. And so it is critical that get done. And it's a balance. You have to do both. You've got to build new beds. And you have to redevelop the old ones. And we also have to look at, is there a space that's in between that helps people to stay supported?
Exactly.
Maybe in a congregate setting before they get to long-term care, right? So so we don't have this kind of where literally you're going from crisis into long-term care. Yeah, it's interesting because you'll see when people go into long-term care, it's and I saw this in my own mother-in-law, is within about a 2-week period of some attention, and she improved.
Yes.
Her condition dramatically improved. I mean, she had a decline after that, but it was, and that's the experience I think in a lot of. So we have to. All that being said, is I think we have to look at how do we support people in their homes, and how do we support people to live close together in a setting that's going to help them get the support that they need, and also that they can support each other.
Definitely, because it's basically looking at not only that we're looking at long-term care, but then we have to look at home care. So both of these need to be looked at together, not separate entities, but together to further support, because not everybody wants to necessarily go to long-term care. They're being forced to go to long-term care because they don't have the support at home, just like you had mentioned in your example, right, with your mother-in-law. So I think those things need to be definitely looked at.
Oh, yeah.
And what would you say, I know that, you were part of the Dalton McGuinty government, and in terms of bringing, I guess, other changes, because a lot of the residents are mostly wheelchair-bound, dementia, and then of course we don't have the staffing. What do we need to, kind of further bring about the implementation of having that re-imaged going forward?
Well, I think you have to understand, like, the needs of the residents in long-term care have changed over the last 20 years, like even over the last 20 years. So there's higher incidence of dementia. People have more frailty. So you need to have, I think, really very importantly, the introduction of palliative care into long-term care, because essentially almost every resident in long-term care fits in the palliative diagnosis window, right, of 18 months. And so not exclusively. And so that's something that I worked on in as a member in government, to try to improve the quality and access to palliative care and long-term care homes. I think that's really critical. Behavioral support. We took steps forward as a government. I think that we're very positive, but as with all things,
Yes.
There's still more work to be done, right? You just it takes a lot to change an environment where there are 78,000 people in 626 different places.
Exactly.
And so, and there's a big culture change that has to happen. And it's not just a culture inside the homes; it's in our culture.
Yes.
And so, and that's one that governments can try to help change, but other leaders and people have to take a look at that. And I think the pandemic has made that very clear and very evident. And as we get farther away from it and we look back on it, I think we have a lot to reflect on.
Yes. Oh, yeah, we really do, to really make sure that we get it right going forward, and to make sure as a society that we change, we look at things differently. Not that this is something obscure, that this is something that is happening now and will be more so, even more so in the future. Now, you did talk about, in terms of your volunteer experience in palliative care at the General Hospital in Ottawa, and what would you like to see changed in long-term care standards pertaining to palliative care, and in particular with Bill 3 that just recently was passed, in terms of how that can be more accessible in long-term care?
So no, I think there's some work that's being done right now about here at the Burley Rideau Veterans Home about creating at the point of entry into long-term care, admission, I should say, that there are steps that are taken to begin that pathway, because palliative care is a path, right?
Yes.
And so that pathway needs to start when you come in the door. And the palliative approach is one that looks at the whole person. So it's not just pain and symptom management. That's a really big part of it, to be able to give people quality of life. But it's like, what else is important to people? And so, if I look at the two big long-term care homes, we're running St. Pat's and the Pearly, they have a lot to. They're public homes, publicly funded and publicly run homes. They have a lot. They have recreation programs. They have a lot to offer to a lot of community involvement, to lift up the people, lift up the residents, to give them something to look forward to, right? So it's, there's, we have this perception of aging that that a person's contributing less than they were before, right? It's, that's just kind of this paradigm that's there. And then you get old, there's nothing to look forward to. Well, that's not true. It's not true at all. It's, they're, a very quick story. When my mother-in-law was in her 80s, the Queen was coming to Canada. She loved the Queen. She never had a chance to meet the Queen. My father-in-law wrote a story about how he'd actually worked on the advance team when the Queen was first became the Queen, and never got to meet her. And that my mother-in-law had some connection through her brother's, one of who died in the war. Anyways, shorten up the story. She actually got to Rideau Hall and got to meet the Queen, and just because he wrote that letter.
Yes.
And so she, not just in the receiving line, somehow she got into the receiving line, not just sort of in the. And so I just remember that story, and there have many more like this about other people, is that there's always something to look forward to. And that's the thing, that's the thing we should be doing inside residences, right? Like, what is that thing, that connection? It's the connection with people. It's creating things. Art programs are, I for the first 4 years of my Christmas cards, was a Pearly resident who did a painting or a drawing, and I put it on the front of my Christmas card and sent it out. And it was a big thing. Yeah. And sometimes it was the first thing somebody painted. And now I do it with Roger Nielsen House and Young Kids. But it was first couple of times it really struck me because we made, we made a presentation to the person in the home, and it just, again, it's underscored. It's, life is like, it's about living
That's
well
right.
up till the end, right?
That's correct.
And that's the thing we got to get in our heads. And so I think that's a really important part. We have a pretty medicalized model, and that's understandable because we have a lot of frailty. But we have to treat people as a whole person and not a condition
That's right.
or a frailty or chronic. That they're, just like we should do with everybody else, whatever stage of life. Yeah.
Whatever, yeah, exactly. Because they don't stop living because of it, right? They just want. It's about the quality. It's about the quality of it. And so, back on October the 6th, you had tabled a private member's bill, Connecting Care Amendment Act. So this is part of the Patient Bill of Rights because of COVID-19. And how is this anything different than Bill 203? And how would residents?
Well, it really just complements Bill 203. Like, Bill 203 is a really important bill because the COVID is the great revealer. And what revealed is there's all these people who are essential to people's care who don't work in a hospital or a long-term care home or a group home. And so that bill, Lisa's bill is a great bill. She's had a couple of great bills. She had another one, Dan's Law, that I work with her on. Mm-hmm. And so I had what happened was the government passed a new home care legislation and took out a patient bill of rights.
Yep.
And they said, well, we're going to do it in regulation. Well, actually, patient bills of rights have to have some permanency, and it's more important for them to be in legislation. Regulation's too easily changed, too flexible. So we had some people look at it and say, well, what are the things we need to do here? What things have changed? What's from the previous one? And essential caregivers was one of those pieces. There were a couple of pieces like that, and it was just so. All my bill does is it just essentially establishes essential caregivers as a concept and a person's right to have an essential caregiver.
Yes.
And some rights around that, and I think it's really important that we have a Bill of Rights because it creates a framework.
Yep.
And what people can reasonably expect, and what providers are reasonably expected to deliver. And that's why I think that it's important. And as with most, almost all my private members' bills, I can only get to debate one every cycle, which is every 100 times. But I'm just open to if somebody wants to take that bill, someone says, John, I'd like to debate that bill. I want to put my name on it, or I want to take that bill. And there's some reasonable prospect of it getting, there's a pathway to get it passed. Mm-hmm. I'm good with that. I mean, to me, it's get the idea out. And then, we did that with defibrillators and Franz Chalina and Robin Martins. So that's what I'm hoping with the Patient Bill of Rights is that, the government will look at it, or another member will look at it and say, I think that's important.
Yes. Can
I take this, and can we try to get it through? And so, because it's not, this is something that, I really think everybody agrees on. And so if we can all agree on it, can we find a way to make it work and to put it forward? So.
Yeah, that would be excellent. And even if it doesn't come around this time, I hope it does, it keeps getting presented until it does become part of the legislation. And then, go ahead, Jerry.
Yes, I have a couple of bills that I've presented for the third or fourth time, not related to WSIB for people working in retirement homes and group homes. So there's some equity, and then another one on protecting passenger safety. And so the trick is just keep reintroducing them, have them there as an idea and a concept. Maybe you get to debate them, and you can get the legislature to pass it, or somebody can take it, or the government can look at it and say, we'll change this, or we'll put this in regulation. So it keeps the idea out there. So.
Yes. And it keeps it on the on the table, so it's always still talked about, which is excellent.
Yeah.
Now, I know that you had indicated that you were more so behind the full independent inquiry as opposed to the commission. And what would you say in terms of the difference as to why there should have been an inquiry instead of a commission at this time?
Well, I think we still should have an independent inquiry, because I think that the powers of an independent inquiry are very clear, and there's a very clear distinction between that and a commission, and in terms of independence, and quite frankly, justice. And so there's there's justice for those families. There's justice for those people who have suffered and died. And, we did that in Walkerton. We did that in the mall collapse. So this is right now it's 2,500 people who passed away in long-term care. And it deserves to have a hard look and an honest, open, as they say, shine the light.
Yes.
Shine the light on it and provide some justice to families now. And I think the Long-Term Care Commission has really done some things to talk about what needs to be done right now. So I don't want to diminish it in any way. There are a number of recommendations about what needs to be done in long-term care right now. The government hasn't reacted to. I know we'll talk about it later. Big announcement the other day, and there's things around infection prevention control, having somebody who is just there for resident quality, all the time, permanently full time. Issues around the leadership and management right now during the pandemic. So, I could go and get into the weeds on all this stuff, but I think the commission has laid out some things the government has not responded to, and so, I think we should still have an independent inquiry because at the end of the day, I'm not sure. The government's delay in responding to those and to a number of other things has caused excess mortality and suffering, no question.
Yeah, because the commission's already come out with two major reports already, and there has been no action to either one of them. They're just really repeating what has already been said by the public or by most community organizations at this point in time. So.
And they've requested thousands of documents that the government's still withholding it, and it's the commission. Yeah. So they appointed some people who have some experience and some qualifications, and so I know that they're taking the job, even with the limits of the commission, seriously. And I can tell that by looking at the recommendations, which is you need to do this and you need to do it now.
Yeah.
And it's, I find that it's disturbing that the government, in some ways is, I don't say undermining the commission in the sense of, well, we're not going to give you those, they said, we've given you the documents, and the commission says, no, you haven't. That kind of stuff, just that says, we need some independence, right?
Yeah.
To where there's an ability for, an inquiry to force the government to disclose.
Yes, and to get the information out there, absolutely. And now on November the 6th, your response to the Ontario budget, you said that the government still hasn't guaranteed the full 4 hours of direct nursing and personal care per resident per day. Yes. Now, would you agree, because this is very similar to what the RNAO had indicated in terms of their minimum work hour, in terms of the 4 hours direct nursing and personal care for each resident per day. Is yours the same as that or more in terms of what should be the minimum basic guarantee?
No, 4 hours of care is the thing that we've been working, that's been talked about and worked towards for a long time. And so, when I look at, one of the challenges when you have a change in government, you start on a trajectory in a certain way, and the new government comes in, they take everything apart and rebuild it, as I say, in their own image and likeness. And one of the things I feel the government should have done is just like continue with the work that's there, build on it, change it, make it, make it new and improved, accelerate it. It's when I look at that announcement right now, we're too far out.
Yeah.
And it's good the government's attached some money to it and firms their commitment. That's a good thing.
Yes.
The question is, are we going to get there or not? And the next piece, to make long-term care, number one, the first thing we have to do right now is protect residents. And the recommendations that the commission is making to protect residents right now aren't happening. The government's not responding to those. So if you want to make long-term care a desirable place to work, you have to start right now. It's not 4 years from now. We're not going to do it next spring, right? Mm-hmm. We're not going to do it next September. We have to start right now. And the way that they start right now is by responding to the needs of long-term care homes that the commission has so clearly expressed.
Yes.
right? And the needs of residents, more importantly, the needs of residents. And so, we're at a funny time in politics right now. As opposition parties, your job is to ask tough questions, and and but what people want are answers, and they don't want to see us fighting.
Yes.
I just that's just my take on it. And so it's I want to encourage the government. I want the 4 hours to succeed. They need to do the things that have to be done right now, or they'll have a really hard time succeeding. So.
Yeah, and that will be the major challenge. But as long as everyone can be able to come together to be able to discuss it and then to be able to move forward with it, right? Because that's what we really need at the end of the day. And to bring everybody to the table and have a proper discussion to be able to move this, move this forward.
Yeah.
So.
Well, we've all agreed on. We've all the
Yep.
legislature has unanimously voted for it. So it's how do we, how do we make it happen?
Yes.
As quickly as we possibly can, and the way to do is start now.
Yeah.
Yeah.
So. Absolutely, and I guess part of that discussion would be that not only for that 4-hour piece, but as well for the training that goes into for whether it's be the registered staff, whether that's nursing, the registered practical nurses, the PSWs, social work, again, palliative care, all of that would have to be looked at in terms of adding that additional training, because that training piece is key, and sometimes they don't have that when they're working in that type of environment. Would you agree?
Yeah, no, I agree. No, and it's interesting because, I've seen, I visited a home in Ottawa, not on my riding, that I can't remember the provider, but they provided a $500 bursary to anybody who worked in the home every year if they took training.
Wow.
And they backfilled them. And they weren't a nonprofit home.
Oh, wow.
So it was actually what the home understood was, our people are our most valuable asset. So we have to keep investing in them.
Yes.
And so that has to happen. That has to be the attitude of the employer. That has to be the thing the government demands of an employer.
Yes.
You have to, and supports. It's not just it's creating pressure, but also supporting employers to do that. And so because my former boss said to me once. He said, "It's amazing how important that person is who's taking care of your mom, because you can't."
Yes. Yeah, absolutely.
Right?
Yeah.
So, and I think COVID has made that really very clear and evident to everybody, the value of the work that people do in long-term care and home care and all sorts of personal care. It's rewarding work, but it's really hard work, and it needs to be valued.
Yes, absolutely does. Yeah. Because once you value people, they'll give you back as much as what you've given them, right? So
100%, yeah.
We really do. And then part of that value process in terms of what the current wages, that's the other thing for workers in long-term care. How much would you, I guess, would say in terms of what would need to be a decent wage, and what potentially should that increase kind of look like for the government?
Yeah, well, I think the thing is right now the government's they gave a $3 raise, which is $1 less than they gave for pandemic pay. I think pandemic pay is the starting point. I think the $4 an hour is the point at which they should have started and should have continued.
Yes.
And because the work is still arguably as dangerous as it was in March in many homes, and you're going to need to be able to recruit and retain people. And I think that one of the things that you should do from there is, if you're going to give people the possibility to train and up their skills, is that you start to look at, well, are there inside classifications of just like with RNs and in RNs you can find that in terms of when people upskill. Yes. There's kind of a scale there. So is it the same thing at RPNs? I'm not sure. I don't think so. PSWs, is there, if a PSW acquires palliative skills. I remember I actually was in a home, actually the same home that I went to where they had that training bursary, and the PSW was the lead of the palliative team
Oh, wow.
inside the home because she actually had the skills. Like she had the leadership skills to be able
Yes.
to do that. Right. So if somebody has that leadership skills and they're leading a team, you should recognize that.
Yeah.
Right. There should be they should be compensated differently. That's that's how we do things everywhere else.
Yeah.
So it's that that shows people that it's an acknowledgement of their value and worth.
Yes.
It's not the only one,
No.
but it's an important one. It helps. It also helps you retain people, right? So if people have good benefits and they're getting decent wages, and their working conditions are good, they're not going to go anywhere. But if they have to take 3 different jobs,
Yeah.
and the conditions aren't good, they're no matter what field you work in,
That's right.
you're going to have a hard time staying in a place where you maybe feel that the work that you do is not valued or actually acknowledged.
Yeah.
The simple acknowledgement of it, is a big piece too, right?
Yeah, because that goes with their empowerment as well, right?
Yeah.
So they feel more engaged within their role that they're doing. And so during the second wave, we're still hearing talk of, lack of PPE supply at some facilities. What would you say to this in terms of why we're still, it's now December, and this is still an ongoing discussion, talk, and being brought up about?
Well, I get concerned about the lack of leadership in terms of making that a priority, and then looking at leadership. I'm not just talking about the top inside the ministry in Toronto, but if you look at the regional leadership,
Yes.
right? I know I was talking to somebody about this the other day. I don't know the answer to the question. I know we have a dashboard for hospitals.
Mm-hmm.
Okay. So in most regions, at least in my region, they have a dashboard for hospitals, right? So they know what's going on in all the hospitals all the time. They want to make sure the flow is good. Are we doing the same thing in long-term care right now in terms of, are we actually looking at where are our greatest risks?
Yeah.
Right? This pandemic is we're managing risk. And so, who's confirming at the top that the things that are supposed to be happening, like PPE or infection prevention and control, or the proper transfer of people to other facilities, whether that's happening or not. Like someone's got to take charge of that.
Yes.
And because, it's just simply that's the way it's going to work. So I think that I look at leadership for that. I'm not saying that it's easy.
Mm-hmm.
What I think in this pandemic, the thing it's shown us is that you need a leader. Somebody's got to make that decision. Yeah. Someone's got to say, have you checked this? Have we done that? Right? You're responsible for this. So that structure and that leadership, whether it's 1 people or 2 people or 3 people at the top, and people with their own responsibility, that leadership structure regionally,
Yes.
I think is really critical to making sure that those homes that are greatest at risk have the things that they need and that their challenges are addressed. And it seems that there's a lot of delayed decisions. So you have families calling for some intervention at Madonna here in Orleans and Ottawa for 3 weeks. Right? And then, by the 4th week, it happens, right? Well, the problems that were there just got worse over 4 weeks. You could see the direction it was going to head in.
Yes.
And so, and those delayed decisions have, not having PPE, it just leads to transmission of disease and other, and the consequences of that, which is suffering and unfortunately sometimes dying.
Yeah.
Death.
Which is not, not the way that anybody wants to, to pass on, and for the families to experience that is just not a very good memory in their minds as well. So I know during the second wave, Ottawa was greatly impacted in terms of COVID-19 cases in long-term care. And what were your constituents telling you about what needs to be changed in long-term care? Because we had like West End Villa, we had extended care. I know they're not in your particular
Starwood,
Starwood. But what are people letting you know?
Well, I just, it's a really interesting thing. It's kind of an inverted problem. At the Pearly Rito Veterans here in Ottawa, there are 100, actually now it went up by 120 single rooms that are vacant out of 450. Right. So I had a constituent that I keep walking by Pearly and the rooms are empty.
Yeah.
And so I was really surprised. That's a big number, given given that there are people waiting in hospitals and home,
Yeah.
and people, there's some really very, very sad situations, and so, the reason that is that out of a home with 450 beds, 1,000 staff, if you have one person who is isolating at home with COVID,
Yes,
because they got tested, you don't do any admissions. So there's another piece, which is we have to look at how do we manage risk across, not just in long-term care, but across society, right? So
yes,
I know of a couple where the husband is taking care of a wife who has kept her at home as long as he possibly could because he loves her
yeah, of course.
and he wanted to do everything he could for her. But sometimes people make those decisions and then they find themselves in a situation where I waited too long. We all do that, right?
Yeah, yeah,
Well, how do I explain to them that how does that make any sense to them, right? So that there's space, maybe half of that space would be. So that's one thing that came up, and I think that's a problem we have to address. We have to look at how do we manage it, and actually how many rooms across Ontario are vacant, and how can we reasonably find a way to manage the risk across, not just in the long-term care homes, but across society, right? So that's one thing. Definitely the level of care. We don't have as many access problems as we had in the first wave. The first wave, it was just all, I can't get in.
Yes.
And so, and now it's, I think, I know that there's still challenges that exist around the province, but definitely not as acute as it was in the spring. And so I think people are reticent to put their loved one into long-term care.
Yes.
So, and I think that's something that will linger. And so there'll be a lot of work to be done to lift up long-term care and make those changes they're going to make to take away that reticence to do that.
Yeah.
Challenges around home care. Actually find home care where that's a bit of it's an untold story.
Yes.
In this pandemic, and it's harder to long-term care homes are kind of geospecific and congregate. They're easy to find, so home care is spread out inside people's private homes in their private lives, and it's really hard to measure.
Yeah,
it's hard to measure and hard to see. More importantly, hard to see. So we're going to have to turn our minds to that. Because there's also, a challenge with, there's going to be a challenge with, competing. I know the pandemic, the increase, I think, is spread across all PSWs.
Yes.
But there's going to be a competition for support workers in different sectors, and there's a lot of work to be done to recruit people and I think to support families who are doing their best to take care of their loved one at home or a friend or that's the other piece we talked about at the beginning. I think we have to look. Fixing long-term care is really important. Part of fixing long-term care is how do we fix it in the community?
That's right.
So that we put less pressure on the system, and so they've mostly in European countries they've figured out different models of how to live together, right? How to support people in communities, and I think it's some form of congregate living or living close, or you see some of that in Ontario right now with seniors villages. And,
yes.
But then there's the whole question of affordability and access. And quite frankly, I think the public the models reflecting that care for the elderly or us as we age is a public good,
Yes.
right?
Yeah, because I don't think that we can be able to sustain the model currently, as because the population is, getting older, and that is,
Yeah,
some of the baby boomers. So that's going to, almost double in size as to what is
yeah,
currently happening. So whether or not that model of building these warehouses will be
yeah,
sustainable model moving forward, right? So
yeah.
yesterday's
Yeah, no,
announcement,
it's a challenge. Something it
yeah,
became for governments. The model that's going to change in the late '90s, I think it was. It just the governments didn't incur debt, and then the places, in other words, you could build a long-term care home. It's like it was cookie cutter, right?
yeah,
So if somebody's building two, they're building 20, right? And
that's right.
all the pieces that are in place, so you could do it quickly. So if you're behind, that's how governments, it's much harder, for St. Pat's. And I worked on St. Pat's before I got elected. I was working for the former premier. I mean, that took us about just 2.5 years to land how the funding would work with the organization, because they hadn't built anything in 40 years, right?
Yeah,
And so they weren't. So if we're going to get to I think we need to get to a way where we incent communities to build long-term care, to provide the governance and the solutions
yeah,
to caring for our elderly. And to do that, you've got to find a way to support them, not just with money, but
exactly.
with the expertise. And so I think that public good and the connection of public governance is really important in the care that we deliver to people, whether it's long-term care home, a hospital,
Yeah,
a hospice. So
definitely.
that's sort of getting into the weeds a bit. Sorry.
No, 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 no. That's fine. That's fine.
Yeah.
And but I mean, lastly, in regards to the announcement yesterday by the government announcing the changes or what they're going to be putting forth, but that won't take place for another 4 years, 2024. What's your stance, or what do you think of what the government announced yesterday?
Well, the thing is I think it's given. Look, it's good to see that they put some dollars and a commitment to it. The plan's vague, and even if you just go simply to pandemic, the PSW wage increase. Well, there's nothing about it extending past next March
Yeah,
in that document, right? I think it would be there. That's kind of a big first step. So I think that piece is missing, and it is something that the commission said that the government needed to do this, and which I think it's not surprising because it's been being said for a while.
yes,
And I think what the government needs to do is focus on those recommendations that the commission has made that immediately will make seniors in long-term care or people in residence long-term care safer around infection and prevention and control, around having a quality person there, around choice and transfer to patients, not patients, I should say residents. And so they made a number of recommendations. And I think that's the first step is really confirm the PSW, just say, yeah, that's not going to stop.
yeah,
Because there was a 6-week gap this summer. They should do that. And we're going to address all these things that the Long-Term Care Commission is saying right now, because they're not just about right now.
exactly.
They're about it's about improving for the future. And that will be the indication to me that the government's serious about addressing the issue. And so I don't, I don't want to doubt them, but those are the tough questions. And that's what, that's what they have to ask themselves. And that's why we, from in opposition parties ask them, because they have to address those things. You're not going to get to where you want to get to if you can't do the things you need to do right now.
Exactly. And this is where, and right now is where everything is happening as well. So we need to have a plan as to what's going to be taking place now and in the future, just like you had said. So how can either constituents within this province be able to further make sure that, keep this on the pulse for the government and hold them account to make sure that they actually do the changes that they're going to be doing?
Well, I think one of the things that people can do as a good start is, if you can, become involved in your local long-term care home. If it's a publicly funded one, if not publicly funded, but a not for profit, or a municipal home, or if there's a private home that's going to provide that kind of support. But anyway, just number one, become involved. Write your members. Continue. The thing is, there have to be, right now, those things that need to be in place need to be there. And I think to continually press for that. But also, I'm going to be frank, is in long-term care, if we want to change it, we all have to find a way of becoming involved in it, right? Whether that's writing a letter, or whether that's actually saying, maybe I'm going to spend a few hours a week at a long-term care home, or maybe I'm going to find some way to support a recreational program that they have. I think that's important. And then, put pressure on your members. It doesn't matter. It doesn't matter what party.
Yes.
Right. Yeah. So you have to, we're going to keep pushing, but there's always got to be people pushing, all of us. And I think continuing to make this a high priority for your community is a way to do it. And that's talking about it. That's becoming involved, and hold governments to account. It's just, ask next election. The first time I think that I saw, that it is an election issue was in the last election. But for the previous 20 years, we went through cycles where it really wasn't elevated to, and I wouldn't even say it was at highly put up on in the campaign. There are a lot of competing issues, but it's evident that right now this one has to rise to the top.
Yes.
Right?
Absolutely.
And the way that's going to rise to the top is if people say, this is the most important issue to me right now. And I think that's the best way to do it. Sorry for the long answer.
No, that's perfect. That's perfect. No, thank you. That's really great. And I appreciate that. And I just want to, again, thank you so much for coming on to the Long-Term Care Chronicles. And thank you again.
Yeah. Well, thank you. Well, thank you very much for doing the podcast, because the message needs to get out. And I really want to thank you for the opportunity to talk to you today, and just help me articulate some of the things that I believe and I think are really important. It's great to have the opportunity.
Thank you so much. Thank you.
Thanks. Take care.
Thank you for listening to this episode, and hope you enjoyed the conversation. Please leave a comment, as we would love to hear your feedback. Please follow us on Twitter @Family Councils and Facebook @Family Councils Collaborative Alliance. Again, thank you.